Officials at that hospital in Dallas have also announced they are shutting down the emergency room there until further notice.
We have put the emergency department at Presbyterian on diversion until further notice because of limitations in staffed capacity. That means ambulances are not currently bringing patients to our emergency department.
There are also reports, as I alluded to in the interview with Dr. Frieden, that the healthcare worker, the identity of that person is that she is a female nurse. We're going to go to the chairman of the House Homeland Security Committee, Michael McCaul, who is in Austin this morning. Mr. Chairman, you held hearings down there. Let me ask you about that first. Have you been able to confirm, is this a female nurse who was infected?
We have confirmation that it was a nurse at Dallas Presbyterian. I don't know the gender of the nurse, probably most likely female, but this really raises the issue of protocols and proper protocols and procedures. Remember, Mr. Duncan, when he was first admitted, said he came from Liberia, had a 103-degree temperature, and then was released onto the streets, which also causes a threat to other people out in the community. And so we believe that the hearing that was brought out with CDC and Homeland Security officials and state and locals, that they need to start following better protocols. And I'm very saddened to hear about the nurse being exposed as well, because as I understand, the nurse was wearing the protective gear, and there must have been some breach of that protocol.
Well, it sounds as if, like, for example, that this may have happened when this nurse was taking off the gloves that they wear, or something of that nature. But clearly, it does underline the sensitivity. Our Dr. John LaPook, who's going to be with us later in the broadcast, has been talking to officials at the CDC, and he tells us that they are now considering sending Ebola patients to just one of the 4 designated facilities in Emory, in Atlanta, at NIH, at Montana, and in Nebraska. Do you think that's a wise step there, if they should do that? Is that necessary?
Well, I think that may be wise, because they're best, they have the expertise to deal with this very horrific virus. And we had 5 cases. Mr. Duncan passed away, unfortunately, and now we have a new case. And so I do think that's important. And also it's important that we eliminate the source or threat at the source. And the source really is in Africa, where it's spreading like a wildfire. We have now over 8,000 cases of Ebola spreading throughout Africa and West Africa, 4,000 deaths. And I think there's a lot of talk about banning flights. I think we need to target more the individual themselves and look at the idea of potentially temporarily suspending the 13,000 visas that would be coming out of this region, allowing healthcare workers to go in because they have to contain the threat. But then when it comes to the sort of the original population out of West Africa leaving, I think until this gets under control, that's a measure that policymakers ought to be looking at.
Well, we have, as you well know, started screening at 5 airports now in this country, where most of the passengers from those 3 West African countries come from. Do you think that's going to help?
Well, I think it will help a great deal. We do screen at the point of origin and then the point of entry within the United States in the top 5 airports where they would potentially come through. They are secondarily screened automatically if they come from the country of origin, and a Coast Guard medical officer will do an evaluation, including a temperature analysis. Now, this is a virus that incubates for 21 days, so that still leaves the possibility that somebody could actually still get through that process.
Mr. Chairman, we're going to have a lot more on Ebola in the second half of our broadcast. I want to thank you for joining us this morning. We will also have a report from Liberia, by the way.